What if an algorithm, not a person, helped decide how much care your parent receives? In Australia's aged care system, a digital tool called the Integrated Assessment Tool, or IAT, now plays a key role in determining home support funding. Some clinicians say it improves consistency. Others warn it may override professional judgment and potentially underestimate real needs. So what does this debate actually mean for older Australians and their families? Today, we're breaking it down clearly and calmly. Hi, I'm Elsa. With over 25 years of experience as an aged care consultant in Australia, I'll be sharing practical advice to help you navigate these changes. Let's get started. The Integrated Assessment Tool was introduced as part of Australia's broader aged care reforms under the Support at Home framework. Its purpose is to standardise assessments nationwide. The IAT is used to assess functional capacity, evaluate support needs, determine eligibility categories, allocate funding levels. The goal is consistency, applying the same framework across regions to reduce variability and improve transparency. On paper, that sounds reasonable, but ageing isn't always predictable or easily categorised. Some frontline assessors report that the IAT's classifications occasionally conflict with their professional judgment. Concerns raised include limited ability to override algorithm outcomes, reduced flexibility in complex cases, risk of misclassification, perceived erosion of clinical expertise. The tension isn't necessarily about technology itself. It's about how rigidly it is applied. Because human aging is complex, needs fluctuate due to chronic illness, cognitive decline, mental health, social isolation, cultural factors, and family circumstances. A structured tool may not always capture that lived reality. When assessment outcomes don't fully reflect real needs, the consequences can be significant. If support is underestimated, it may lead to reduced home care hours, delays in equipment provision, increased falls risk, carer burnout, earlier transition to residential care. Accuracy isn't just administrative. It directly affects safety, independence, and well-being. Another key issue is transparency. Families often ask, how was this funding level calculated? What criteria were weighted most heavily? Can this decision be reviewed? Trust depends on clarity. Automated systems must remain accountable, especially when they affect vulnerable Australians. A balanced model would include clear override mechanisms, transparent appeal pathways, ongoing evaluation of algorithm outcomes. Technology can support care, but it must never dehumanise it. If you or your loved one undergoes an aged care assessment influenced by the IAT, ask for a clear explanation of the outcome, request written summaries, clarify funding categories, understand review pathways, document changes in daily living over time. Preparation strengthens conversations. Medical documentation and clear examples of functional challenges matter. Reform is still evolving, and constructive feedback helps improve the system. Assessment outcomes influence funding levels and provider choice. Understanding how classifications translate into actual services can be complex, especially when terminology varies between providers. SSCA provides a free care finding service for families in Melbourne. With over 25 years of experience in the aged care sector, we help you understand assessment outcomes, compare provider fee structures, analyse service flexibility, match care needs and location with suitable providers. Clear information reduces stress, and informed decisions protect dignity. If you're navigating aged care assessments and feeling uncertain, support is available at no cost and with no obligation. If you found this video helpful, give it a like and share it with others. Subscribe to our channel for more insights into aged care in Australia.